this is my table of contents, and I'll be talking to you about following, ranging from an overview to my research study. So what is obsessive compulsive disorder? Basically, it's a type of anxiety disorder, and what that means is anxiety means it causes stress. So it causes stress. It causes obsessions and compulsions, and obsessions are like what you obsess over and like what like you get scared over, and compulsions are like what you do because of your obsessions. The causes of OCD are not exact. They don't know. It's not fully understood, but they have two basic ideas. One of them they think are, or one of them they believe are environmental factors, and that includes like an illness they might have had before. So if they were sick, it could affect them, or if they had relationship issues with their family or their partners or something, and if they were abused when they were younger. Then there's also biological factors which can cause OCD. That happens in the brain and neurotransmitters, and a type of that is serotonin. And there's an imbalance of them. There's too much of them, or there's too much of them in your brain. So that's another reason they believe that could cause OCD. For the symptoms, there's two main ways to categorize them. You can categorize the symptoms by your obsessions and then your compulsions. So if you, like some obsessions, symptoms are the fear of contamination and germs on themselves, causing harm to somebody else, being embarrassed, making mistakes or something evil happening to you, also being very neat, and constantly doubting yourself is another obsessions. And then there's compulsions that are like symptoms to what you do because of your obsessions. So like because of your obsessions, you repeatedly wash your hands a lot, or you take showers or bathe a lot. You don't like to touch some objects such as doorknobs, or because of you think they might contain germs. If you check and recheck something, like to make sure that you did it, because if you're not sure you did it the first time. Another one is counting numbers over and over. So like you might like say like 1, 2, 3, 4, like over and over, because that's some of their rituals. You repeat tasks, you do them over and over again. You put your items or things in a specific order, and if you're stuck on words and images in your mind, that's another compulsion. So the diagnosis is whoever you go to, usually a psychiatrist or a doctor, they use a tool called a structural clinical interview. Basically, it's a test with standardized questions, and they use it to see if the patient's symptoms they match up to those symptoms of a person who typically has OCD. And the questions, questions range from like what's occurring to them, what symptoms, the severity of the symptom, and the duration of them, like how long have they been happening, or how often do they happen. And the treatment for OCD it's a disorder that will not go away just by itself, but there are two types of therapies that people can go through. There's medication therapy and there's cognitive behavioral therapy. And some psychiatrists will recommend that they only go through cognitive behavioral therapy or just medication therapy, but the most effective way is to go through both of the treatment options. So cognitive behavioral therapy, that's like basically when you talk with their psychiatrist and they teach them to confront their fears. They usually people with OCD, they'll have rituals and things that they usually do, and that'll cause them anxiety and stress. So the doctors will try to reduce that and tell them, or try to figure out ways and help them to stop it. And like earlier, like the symptoms I said that they have disturbing thoughts and images, they will try to get that out of their head so that they can just like live their daily lives with a little bit less basically, in the brain and the transmitters, the inhibitors stop the serotonin from attaching. So this medicine will be able to fix that and balance the amount of serotonin. So now for my research design, my journal article was about the patient preferences for OCD treatment and how they prefer to be treated. The purpose was to explore about the treatment that persons with OCD want to go through. The hypothesis that they came up with was that a majority of OCD patients would select a combination of both medication and psychotherapy as their top and primary choice for treatment overall. So materials, this was relatively simple. They had a phone, they had participants, they had paper and pen, and this took place at the OCD Research Clinic at New York State Psychiatric Institute. They didn't really have many, it wasn't like a hard experiment to go through. The method was the authors of this journal, they called 148 different people and asked them if they would like to take part in the survey. So after that, on the phone, they went through a phone evaluation by trained OCD screeners, or the person giving them the survey. And the participant in the survey had a choice. They could agree if they wanted to do it, and out of the 148 people, 89 people agreed that they would like to take the survey. After that, the questions that they were asked were about current symptoms that they were having, their medical history, and also their treatment history. After they got those, they gathered results of what the participants said, and this is what they got. So this is one of the tables that they formed, and it basically deals with demographics. And so out of the 89 patients, the 38 of them were males and 51 of them were females. The race was primarily Caucasian at 77%. The ethnicity and the least at Asian, which was 3% and 3 people. Yet the most predominant, the most predominant ethnicity was non-Hispanic. And the marital status, where most people were single and not married. For religion, the majority were Catholic. The income, the highest income was $20,059, and the least was $9,000 to $19,999. And they had their education written, then they had their employment status, and most of the people were employed, and the least were disabled. And then these last 5 are how they took, they asked them if they're treatment naive, or if they're currently in treatment, if they're going through psychotherapy or medication, or if they're doing a combination. And these are what they used for the table in the next table that they have. So these are the samples. So they have everybody, and then they have the people that were treatment naive, the people that were in treatment, the people that are currently not in treatment, and the people currently on medication and currently in psychotherapy and currently in both. EX and RP stands for exposure and ritual prevention, and SRI is a medication which is the serotonin reuptake inhibitor, which I said a little bit earlier. And then the last one is a combination of both of them. And these are how they were the rank ordered, and the investigational psychotherapy ranked #1, and the deep brain stimulation ranked #5. And out of the entire sample, 37 people took just exposure and ritual prevention. 14 people took just the medication, and 38 people took a combination of them both. And as I was reading through the data, they said that there was no, between this first table and this table, they didn't really find a significant enough relationship between the demographics and the forced choices over here on the table above. So this is my last and final table, and this table basically services. And this is what they asked them, or what they told the person on the phone, and this is like what they said. So, for example, they said, they talked to them about the tailoring treatments to individual patient needs, and the quotes that somebody said on the phone was, everyone is different and should be treated based on their specific symptoms. And also, 51% of participants made recommendations for improving services and treatments for OCD. So this is my discussion or the conclusion. So they confirmed the hypothesis that most participants choose the combination treatment of the medication and the psychotherapy, but how they were a little bit surprised that the exposure and the ritual prevention was almost as often occurring as the combination, because they did not expect that to happen. And they said that for future studies, they would like to examine treatment negotiation and better adherence to treatment recommendations. Does anybody have any questions or comments?
So just to clarify, the 148 people were all diagnosed with this.
What was the journal again that you got this from? Could you go back to that? Thank you.
Can you go to the symptoms page?
For obsessions, what does it mean, or what do you mean by an evil happening?
Like they're scared that something, or like evil as in like, they're scared of something bad happening to them, like maybe like getting murdered, or something evil. Yeah.
Thank you, Mr. Honda. I have a question about the nature of the research that was done and the qualitative aspect. I know your third table said it was based on the qualitative research of the interview. Did they mention how they categorized that into themes or analyzed that data specifically?
Do you mean like
The third table.
that one? Or that one?
No, the third one. Yes, this one. This one says it's qualitative data. So it would be like the interview, what the people were actually saying, besides just the statistics. Did they talk about how they analyzed that? Because I see they have it separated into domains.
Yeah, they didn't really go into depth about it, but the main thing that they mentioned about the table was that 51% of participants made recommendations for improving services and treatment. Yep.
Regarding the collection of data, perhaps questioning the quality of the data, do you see any limitations as to or perhaps some suspect elements in their method of collecting the data?
Well, they didn't, some limitations were how they got their data was from the OCD research clinic at New York State Psychiatric Institute. They didn't really they had one area where they called people from on the phone. They didn't really have a large area, and also they, as I said, for the ethnicity, they didn't really go into depth about. They just said Hispanic and non-Hispanic. They didn't say what ethnicities and nature they had. So if they broadened or expanded what they had.
Did they? Were they certain that these individuals that they were calling had OCD or had been prescribed with OCD, or not prescribed, diagnosed with OCD? And in which case, how did they obtain that information?
Well, they had all of everybody they called was diagnosed with OCD.
Was being treated by them at the time, or?
Yes.
Okay.
At the
Okay.
Yes.
Mr. Honda, just to add to that, these research clinics and institutes, when you are diagnosed with a disorder, you're given a choice as a patient to participate in the research that's going on. So they have these specific clinics that they set up for. There are clinics for schizophrenia, etc. And the researchers can, when they can participate with these research research clinics, and they're provided with the information of these patients to call them so they can gather this information. That's how they're grouped together like that. That's how all the patients, they knew they had OCD. They had been diagnosed, not necessarily by them, but they knew they were diagnosed. So just for clarification on that.
What does the patients being Hispanic have to do with? Like, why were they grouped into Hispanic and non-Hispanic?
Well, that was just